an agreement that we entered into with the county whom we leased the hospital facility from. As a not-for-profit organization and as a community hospital, we're also accountable to all of the regulatory bodies and agencies that not-for-profit organizations and hospitals are accountable to. But the private governance was part of making the hospital work.
Please. Please introduce yourself.
Hi, I'm Dr. Greg Buchert. I'm currently the Chief Medical Officer for Health Net California, and previously the Chief Executive Officer that started Centene's first health plan in California, California Health and Wellness. And I'll give a little bit different perspective on the public-private partnership that here all of you are, or many of you are either elected officials or staff for elected officials. And there was nothing more powerful to get me to move as a CEO.
One more. You also spoke of the ability for there to be a partnership in terms of mental health and not putting folks directly in jail. What about the training for those people? Is there training, ongoing training for the individuals that would put them in jail as opposed to bringing them to the hospital?
Yes, I think that part of the success of that approach is having the law enforcement officials trained so that they know how to intervene appropriately and where to take people. And it is making a difference. On the other side, though, there aren't enough trained mental health workers. So about 10% of the patients we see every day in our emergency department have psychiatric illnesses, but there are no psychiatrists in our community. So that's part of that lack of healthcare professionals, the need for mental health professionals.
Thank you.